I wanted to ask about numbers that you have out of the registered nurses and registered midwives. What sort of percentage do you cover as in the Royal Colleges?
Here in Northern Ireland, about 95% of midwives belong to the RCM. We have opened our membership a few years ago to maternity support workers, but they're not trampling us in the rush either. But we do include them in all of our discussions, and we would very much welcome applications for membership from them. But of those who are registered midwives, about 95%.
Okay, so questions. Who's going to put their hand up for a question? I know you must have, because right here. Thank you. Could you bring the mic here? Could you, once you've got the mic, could you tell us who you are, where you work, and who your question is directed at? Thank you.
My name is Verena Wallace. I'm the midwifery officer in the Department of Health, and my question is for Denise. And it's not a plant. She hasn't bribed me with chocolates or anything. Denise, I was just wondering, of all the things that you've done through the maternity collaborative and the QI work, which is the thing that you're most proud of?
I mean, I suppose from an outputs perspective, I think all of them are important. I think the thing I would say I'm most proud of from the collaborative's perspective is just the collaborative, because it's having the professionals in the room. And I do get where you're coming from, Crystal, about, collaboration is, is kind of about talking to the enemy. And it sometimes, at the start, it really actually felt like that. It felt like, we were on opposite sides of some great divide, and our women and babies were in the middle of it. So I would say the collaboration is actually probably the bit in getting to the point where midwives and obstetricians sit round tables and discuss things as professionals together, has been the biggest sort of achievement of the collaborative. From an outputs perspective, it's constantly changing, because there's always something new that we're kind of going to develop. But I was chatting last night and to Crystal and saying that I don't practice midwifery anymore, and one of the reasons is because we developed a maternity handheld record for Northern Ireland that every woman carries, and I was doing still doing some kind of very occasional clinical work, and couldn't make head nor tail of this record that I was, quite instrumental in the development of. But it was when you weren't using it on a day and daily basis, it was hard to see round. But it's probably one of the biggest things that we've achieved in Northern Ireland, probably because it was the first.
Thank you. Thanks very much. Nikki.
Nikki Patterson, Director of Nursing in the South Eastern Trust. And my question is for Colm. Thank you very much for a very thought-provoking presentation, Colm. I'd be interested, particularly in Charlotte's comment of the importance of us looking at the positive, as well as recognising when things don't go as well as they might. And if you have an example for us of where professionalism within social work and nursing has worked really well, a fried egg example, if you like, as opposed to the scrambled egg.
Thanks very much, Nikki. I think you're probably in a better position to answer that than I am. I think there are lots of very strong examples, and I think it's interesting that one of the areas, perhaps
Public forum.
Yeah, it's hard to be absolutely precise about the publication date of it in the absence of having a minister, which would be obviously the most desirable situation to be in, because this was commissioned by a minister, and we would like to see a minister launch it. However, a lot of work has been undertaken. There's been a lot of engagement across professional groups. Maybe some in this room have been involved in that process. The Transformation Implementation Group has signed off on the document, as indeed has the top management group in the department. So I think what I'm indicating to you is that we're getting towards the point where we should be able to launch it, but that decision is yet, that line is yet to be crossed. But it should hopefully not be far away. And as I say, a lot of very good work has been initiated there, which I suppose we're all keen to start taking forward.
Thank you.
Hi, my name's Charlene Rush. I'm the head of supported living services. I'm a nursing registrant and I'm the professional nursing lead for disabilities. My question is to Charlotte and may affect Colm as well. I suppose it's just highlighting the difficulties for registrants working in a community setting and delegating tasks to social care workers, and it's something that has been highlighted recently in terms of where registrants have been asked to support somebody who's very complex needs in the community, for example, through the administration of showing and demonstrating to social care workers the administration of medicines in peg tubes. And I suppose there's limited guidance out there. I know we work under the delegated framework, but it is highlighted an issue for nurses who do work across the social care setting. So just wondering what your thoughts are on that, Charlotte.
Thanks for that lovely question. I suppose that's partly what prompted the review of the delegation framework in the first place, because of a number of queries and concerns that people were raising. And as Colm already says, you see this more pointedly in the community. So we're aware that there are some issues. We've done some scoping around that, and that has led to the work that Colm and Cathy are now leading. They're looking in the first instance at the delegation of nursing care within the family of nursing. And I am aware that there is work going on in social work in a similar vein, although I haven't seen that and I haven't been involved, so I don't quite know what's in it. But we do need to get it to a point where we have a blurring of professional roles that take account of particular situations. I think what I would say to any nurse is, in the current arrangements, you have a responsibility to make sure that the care that is provided is safe, that if you are delegating care, that you are confident and competent that the person you're delegating to has got the skills to undertake the task that you're delegating, and that there's a feedback mechanism to you as a registrant for you to evaluate the effectiveness of the care, because at the end of the day, as the registrant, you hold the professional responsibility for that. So where that is not in place, I would urge you to use the enabling professionalism framework to have the conversations that you need to have.
Thank you, Charlotte. One of the things I was reminded of when you were just speaking is when I had a very similar question at another conference, and was a reminder that actually very often parents are taught about caring for children with complex needs, and we kind of not really delegate but share the care, and some of it can be really complex care, and equally with members of the family who are the full-time carers, that some of that work gets delegated to them. Not really delegated, shared, the co-production. But it's really interesting when it's between or with professionals. Thank you, great question. Great answer, Charlotte, too. Another question here, thank you.
I suppose it's actually more of a comment. I'm Mary Cadell from Royal College of Midwives. In relation to the last question and Charlotte's response, just by way of reassurance of bringing that round to the presentation that Janice and Breda did, that has been raised through our regional forums where we represent the membership who bring these issues both to us as well as their clinical leads, and then through that the mechanism to take it to the department and then work on developing guidelines. So it's not that you're not heard. Sometimes that works a little bit slower, but it does come from many different sources, and the RCN and ourselves and Unison and all those others at the table initiate those conversations. And also in relation to the comment about the workforce strategy, again, we've all been very closely involved in that, and we share the frustration of, we know there's a document there that's had a lot of work into it, and if we had the mechanisms through having a minister or having our structures active, then we would get it out there, because it is integral and central to everything that we're talking about this morning. But it's a very good example, both of them, of how we work together and the roles that Janice and Breda articulated on behalf of the colleges and what we do. So your voice is heard and we do speak on your behalf.
Thank you. Another question. This is here, over there. Thank you.
Brian McGuire in the Southern Trust. In relation to the eggs, again, the analogy of the eggs, I'm just asking Charlotte and Janice, what do you actually see as the yolk of the nursing egg? What is that unique contribution that you believe nursing brings?
Janice, don't fight me over it, honestly. So I suppose the yoke is the bit for me that is the contribution that nursing and midwifery make. And while we talk about underpinning our nursing practice with strong values, I think those strong values are in some ways easier for us to articulate, and they are around treating people with dignity and respect, care, compassion, non-judgmental, treating everybody as an equal, being respectful of the individual's needs, wants, aspirations, and working in co-production with that person to deliver a plan of care in a partnership. I think they're easier to define as the values of the profession, and I guess they would align probably to most other professions in health and social care. The bit that's unique for me is the piece that nursing it looks after the physical, the psychosocial, the emotional, the spiritual, all the elements of care that other professionals have a more specialty focus on one bit, but not all of them completely. And sometimes that gets lost in the blurring of professional roles and multidisciplinary teams. And I see that most prominently, I would say, a little bit maybe challenging, controversial here even. I see that more again, pointedly, if you want to use that word, often in communities, but more specifically in mental health and learning disability. And I have personal concerns about mental health and learning disability nursing being able to articulate the unique contribution that they bring. And what they bring that's different in that care environment is, yes, looking after someone in a psychosocial model, but always focused on improving well-being and health outcomes and using their expertise and knowledge to do that. And that's the added bit that the nurse brings to that care environment.
Thank you.
I mean, all I would add to that is that all of these things are doable. And the policy to move people to the community was absolutely the right policy. I think, Brian, if we always organised change with the patients at the centre of our clients, we would do the right thing. I'm not convinced that we've been always good at that in the past, and some of those examples you give are maybe where we could have done better. And Colm and I have talked about this as well. Siobhan said earlier, there's plenty of work for everybody. I absolutely concur with that. But I am very hopeful with the policy directive looking at co-production, co-design, that we will not make the mistakes in the future that we have made in the past, and that we will work both with staff and the public and clients to make sure that whatever model we're developing is in the best interest of patients, and that it's cost effective, cost efficient, and the outcomes for patients and clients are the best that we can do within what we've got. So I'm hopeful we're moving to a different space in that.